The word abuse means improper usage. In prosthodontics, improper usage of dental prosthesis occurs because of wrong usage of dentures. Tissue abuse occurs in denture wearers because of overextension of the prosthesis, ill-fitting prosthesis, continuous wearing even during the night times, traumatic injuries, faulty occlusion, or presence of bony spicules. Epulis fissuratum is a very frequent clinical condition which occurs as a reactive fibrous hyperplasia, and it is denture induced fibrous tissue. It is a benign tissue hyperplasia and it occurs because of prolonged use of broken dentures inside the patient's mouth. It's very frequently occurs in female than over males and commonly seen in mandibular ridges and clinically presents as small single fold to multiple folds. Traumatic ulcer. The cause of traumatic ulcer is repetitive minor trauma due to ill-fitting prosthesis or self-inflicting injuries with various mechanotraumatic agents or trauma which can also be caused by remaining teeth or is seen in 19.5% of removable denture wearers. Inflamed flabby tissue is commonly seen in anterior part of the maxilla or the mandibular region, which occurs because of chronic irritation due to old dentures or because of improper load distribution on a particular segment of the prosthesis. It can also occur with excessive ridge resorption, and it is also seen in combination syndrome. Denture stomatitis is an inflammation of the oral mucosa because of improper denture hygiene and an associated infection that occurs mainly because of Candida species. It presents as an erythematous stomatitis lesion which causes inflammation and redness of the oral mucous membrane, and there is more female predilection found in 15 to 70% of removable denture wearers. Resins can also cause allergy, and it is because of the presence of di and monomethacrylate resins, and in situations where there are allergic to monomer, the patient has to be suggested of an alternate use of metal denture bases or light cure denture bases. These are pictures which show mucositis because of the presence of acrylic resin allergy. Allergies can also be caused due to eugenol, which is a component of impression material in zinc oxide eugenol impression paste. In such cases, you should use alternative impression materials like elastomeric impression materials. Allergic reactions can also occur due to local anesthesia because the causative agent is preservative, that is the methyl parahydroxybenzoate, antioxidants, antiseptics, and antigens such as latex. All these are drugs which can cause allergy. In such cases, you have a type 4 hypersensitivity reaction, and the occurrence rate is 80 to 90%. In such situations, we detect and remove the irritant as early as possible, and you evaluate the tissue surface, see for any areas of ulcers or inflammation and areas of any exostosis, and especially in the mid-palatine raphe. When you come to checking of any occlusal errors, use to check the occlusal interferences if it is causing any issues to the dentures. Check for the jaw relationships, whether it was recorded properly, and use articulating papers to find out any discrepancies between the denture occlusion. Denture hygiene maintenance should be constantly reinstalled to the patient. The patient should be educated to remove the prosthesis during the night, and so that adequate rest is provided to the tissues, and the patient should be educated on how to cleanse the dentures or to use any chemical means for disinfecting the dentures. So pre-prosthetic surgical management is usually recommended in these situations of hyperplastic, hypertrophied or pendulous tissues, or when you need to be doing any alteration of the bony or soft tissues which are existing. Denture lining materials are recommended when you need to refit the surface of the dentures which are not fitting properly, or when you need to be enhancing the healing of abused tissues with the use of resilient liners. First synthetic liner which was used was polyvinyl resin as early as 1945, and recently there is use of silicone based liners. Liners could be either short term or long term, could be either silicone based or acrylic based. Now, short term soft liners are plasticized methyl methacrylate resins, which was first recommended and described by Smith. For this, the polymer and the monomer is mixed and the material is in the proportion of 1:1.25, and the material is loaded onto the tissue surface of the dentures and it is seated inside the patient's mouth, and the patient is asked to do all functional movements, and the dentures later the excess material has to be trimmed with the help of a knife, scalpel or scissors, and the patients can use this denture and come back for replacement. Specific patient instructions: the patient should be told to return the following day for inspection and checking of the pressure areas, and this procedure should be repeated 3 to 4 days until the traumatized or the irritated tissues are completely healed. No hard tissue should be consumed on the first 8 hours following the application of this material. As they provide immediate relief and comfort to the patient, there is a chance that the patient will be wearing this dentures with tissue conditioners for an extended time, which can actually worsen and attract microorganisms onto the tissue surface of the denture. However, the advantages are, because these silicone based liners have low solubility, there is no adverse side effects, and it enhances healing of the prosthesis, and the procedure for remaking of the prosthesis is avoided. The advantages outweigh the disadvantages of the liners. The disadvantages is, however, low cohesive strength, which can be affected while by cleaners, or when there is mechanical brushing, that liners could be detached from the material. The alcohols can cause an inflammation when used for an extended days, and the replacement of the material should be done with frequent visit of the patient. Coming on to the conclusion, any faulty prosthesis can alter the character, condition and form of the underlying tissue. The pathological changes must be carefully examined and resolved. It is essential for the patient to develop a good oral and denture hygiene habit in order to achieve oral tissue health, aesthetics and control of good oral odor and affirmation of patient's sense of well-being.